All right, good afternoon, everyone, and thank you all for being here. Before I share updates about the progress made by our Racial Equity Rapid Response Team, I unfortunately have some sad news to announce. This past weekend, the Department of Streets and Sanitation lost an employee from complications related to COVID-19. This individual was a dedicated Chicagoan who served our city for 27 years. Out of respect for the family's wishes, we are keeping this individual's name private, and I ask members of the media to do the same. As with each life lost to this terrible disease, it gives us a moment of reflection, and of course our hearts go out to the family and loved ones of the individual, as well as their colleagues in city government. So I ask everyone to please remember to be safe. This disease is highly contagious, and unfortunately we now know over and over again it is deadly. So please continue to stay home and save lives. Today, we're announcing our latest but far from our last steps in addressing the unacceptable, disproportionate impact COVID-19 has had in our city's African American and Latinx communities. Our immediate efforts are focusing on Austin, Auburn Gresham, and South Shore. Communities chosen because they're experiencing some of the worst impacts of this crisis and show the clearest need for immediate action. The Racial Equity Rapid Response Team has organized a steering committee that leads the mayor's office, that includes the mayor's office, the Department of Public Health, and Westside United, along with Rush University Medical Center and U of C Medicine, leading healthcare organizations on our city's south and west sides, UIC's Department of Public Health, and several working groups. I'm waiting for a slide. There you go. All focused around 4 core pillars: education, prevention, testing and treatment, and support services. Through this framework, we've worked to break down the digital divide and ensure residents are receiving critical and contextualized information. Outreach workers are placing literally tens of thousands of door hangers on homes in targeted zip codes that have the highest concentrations of COVID-19 cases. In partnership with community leaders, we have sharpened our message and guidance and are delivering informational flyers and postcards tailored to essential workers, residents over 60, and those with underlying conditions. And we have supported distribution of masks in each of these communities. And in addition to our communications on social media, we've increased our outreach to residents through targeted and nuanced radio and television. Let me assure you that this is not just a one-and-done project. The team has become integrated into Chicago's Emergency Operations Center to help coordinate communications and resources and create a feedback loop for information from the field to be addressed on a systematic basis. These measures specifically allow us to quickly identify gaps and solve problems. And all of this has happened really just in the past week. In developing our effort, we didn't start from scratch or reinvent the wheel. We didn't have to. The team, which is led by 2 women standing with me, our Chief Equity Officer, Candace Moore, and Deputy Mayor for Education, who's hiding actually back there, Dr. Sybil Madison. They are working and learning side by side with our partners from Westside United, who know how to build dynamic partnerships between communities and healthcare systems from their own work in addressing health inequalities and life expectancy gaps in 10 of our Westside communities. They are sharing their insights and relationships as we build this work across the south and west sides of Chicago, and communities that are experiencing a different reality when it comes to COVID-19. One hugely important part of this effort is community-based leadership. This team has partnered with 3 anchor community organizations to help construct a leadership network that will be at the heart of delivering resources and information, as well as delivering the right approaches to fit these specific community needs. And I want to take this moment to thank these organizations for their incredible work, not just in this moment, but all the time, to really stand up and articulate the needs of a community that they serve in and specific concrete solutions. Carlos Nelson, on behalf of Arbon Gresham Development Corporation, Darnell Shields, on behalf of Austin Coming Together, and Anton Seals, on behalf of South Shore Works. I'd also like to thank the aldermen in these communities who have been engaged in this effort. Alderman Taliaferro, Mitz, Irvin, and Scott from the Westside. Alderman Moore, Curtis, Sawyer, and Hairston, Mitchell, and Harris on the South Side. It's these leaders and organizations and community members who are co-creators of our hyper-local approach, and we deeply appreciate the partnership. Moving forward this week and next, we'll be engaging with residents via 3 tele-town halls customized to share relevant information and have frank discussions about what's needed to protect residents and flatten the curve in these communities, just as we've done overall in the city of Chicago. We'll be focusing on developing solutions to food insecurity. For example, the emergency operations teams, the Emergency Operations Center teams are working right now on how to address needed food solutions on the South Side because of what we learned from Carlos Nelson's network on the ground. In Auburn Gresham, food insecurity has been flagged as a significant community need, and that local need has been elevated in a way that we can address it systematically as part of our emergency response to COVID-19. That's literally the work of this team in action. And increasing testing capacity and access to healthcare. And we're grateful again to healthcare leaders like Rush University Medical Center, U of C Medicine, Sinai Health System, UI Health, Lurie's Children's Hospital, and Advocate Aurora Health. They are all part of this process. And these partners are also ensuring our federally qualified health centers are also at the table. As we move forward, we'll be examining how we can proactively reach patients experiencing greater risk factors, such as age and underlying medical conditions. We're doing all this because it is what is necessary to make sure that we are meeting the needs of residents in this moment. As we saw from the shocking maps 2 weeks ago, we may all be experiencing this crisis, but we aren't experiencing this crisis in the same ways. The simple fact is that this disease has spread more heavily to some communities. As I said before, the health disparities that resulted in high rates of diabetes, heart and respiratory disease, and other maladies are the very conditions that this virus ruthlessly attacks. The maps we saw revealed more than just cases of COVID-19. They illuminated the broken and, yes, racist system of inequality that has held these same communities in the grip of poverty for generations, that has withheld access to health care, jobs, and education for generations. The very issues that place incredible burdens on our families before this crisis have only grown exponentially more during this crisis, and thrust into high relief how the issues of equity and opportunity are truly matters of life and death. We cannot simply stand for that here in Chicago. We cannot sit idly by while this disease devastates certain parts of our communities disproportionately more than others. These trends didn't start overnight, and they won't end overnight or by the close of this current crisis, but they must end. And I've said this before, one of the important things that we must do in meeting the needs and the challenges that we're facing in COVID-19 is everywhere build an infrastructure on which we can grow into the future. This can't just be temporary scaffolding. It's got to be the laying the foundation for a permanent fix to many of the problems that for too long we have ignored or said they're too big to solve. Now is the time, as everyone does, that we have so much more to do. Even now, before we are able to lift our heads from this terrible pandemic, I assure you we are doubling down our efforts to fight poverty, to end racial inequality, and ensure every Chicagoan, every neighborhood, every zip code has access for a bright future that they all deserve. These are tough times, but we are going to get through this because of all the hard work and the partnerships that we have across the city, because people all over the city love their neighborhood, love their neighbors. And if we treat our neighbors like ourselves, we will be better for it on the other side of this pandemic. And at this point, I'd like to welcome up Dr. Allison Arwady from the Department of Public Health.
Thank you, Mayor, and thank you for your really amazing ongoing leadership on this. I'm just going to be brief and give an update related to the data. So 2 weeks ago was when we first stood up here and started sharing some of the details related to race ethnicity. Every day since then, the epidemiologists at the Chicago Department of Public Health have been updating on chicago.gov/coronavirus the details related to race and ethnicity. So I'll remind you that as a city, we are 30% Black, 29% Latinx or Hispanic, 33% white, 7% Asian. Where we look at our cases, we are 46% of our cases are in Black Chicagoans, 24% are in Latinx or Hispanic Chicagoans, 21% are in white Chicagoans, and 4% are in Asian Chicagoans. We're at a total of 12,571 lab-confirmed cases as of today. And when we stood up here 2 weeks ago, we were at a total of 118 deaths in Chicago residents when we first broke out the race ethnicity. Just 2 weeks later, as of today, we are at 500 deaths among Chicago residents. And I just want to talk you through the race ethnicity there. 20 of the 500 deaths are still under investigation related to race ethnicity, or 4%. But among the remaining, 287 of the 500 deaths are among Black Chicagoans. 83 are among Latinx or Hispanic Chicagoans. 82 are among white Chicagoans. 23 are among Asian Chicagoans, and 5 are in other Chicagoans of other race ethnicity. So overall, 60% of our deaths remain in the African American community in Chicago, 17% in the Latinx community, 17% in the white community, 5% in the Asian community. I'll note that the death rate remains 4 times as high in the Black community as it does in the white community, and we have seen an increase, particularly in Latinx and Hispanic communities, since we reported 2 weeks ago. Thank you. Yes, next is Candace Moore, the Chief Equity Officer for the City of Chicago.
Thank you, Mayor. Thank you, Dr. Arwady. What has been clear from the start since the moment we announced the Racial Equity Rapid Response Team is that this work is about organizing quickly and collaboratively to deliver action. The Racial Equity Rapid Response Team has formed as a collaborative effort between government, health institutions, and most importantly, communities impacted by the most adverse consequences of COVID-19. And our list of partners continues to grow as both people and organizations come to the table with resources and strategies to meet the need. No data conveys the need more than the mortality instances that Dr. Arwady just shared with us. This data shows us that in no uncertain terms that the most devastating impact of this crisis, lives lost, lands much heavier in certain communities. To date, this mortality data has been our key compass in identifying where we would initially focus on, leading us to Austin, Auburn Gresham, and South Shore. The work we are building is about bringing a hyper-local public health strategy to these communities. This is about distilling down our strategies, contextualizing our work, and learning in real time where gaps and unmet needs continue to persist. To do this, we are marshaling the information and resources of the city, our healthcare providers, our public health institutions, businesses, faith communities, our elected officials, and our community organizations. As we shared, our focus is on 4 key strategies. Education. We will provide communication and updates that are relevant for residents and speak to the realities of their lives. We've already been working to diversify our methods and messages of our communications. The mayor mentioned it earlier, but I'll repeat that we are holding virtual town halls in each of these 3 community areas this week. South Shore will be this Thursday at 5:30, Auburn Gresham Saturday at 10:30, and Austin at 1 p.m. All town halls can be accessed by phone and live streamed through the community organization's Facebook page. Prevention. We are working to ensure residents have the resources and information needed to protect themselves and their families. This has included a team effort this past week, steered by Mount Sinai, to coordinate the dissemination of 60,000 donated masks across each of these 3 community areas. Along with those masks, we've also provided informational cards with targeted guidance, inclusive of essential workers and those living in multi-generational families. Testing and treatment. We continue to work alongside our health department to ensure that the expansion of testing and treatment goes in areas where we see the greatest need and is provided in ways that lower and or eliminate barriers to access. Support services and resources. We are working to ensure people have access to supportive services and resources that sustain their livelihoods. The mayor mentioned how we are moving forward to create more fit food access for the Auburn Gresham community as part of our work. This effort is about building a model that allows us to create adaptive solutions in areas where our overall strategies must go further and deeper. Throughout this effort, we will continue to let the data guide us. The map that has been highlighted has changed since we first began and will continue to change as COVID-19 continues to move across our city. Other patterns will emerge and make evident the need for targeted adaptive action. Patterns, as Dr. Arwady pointed to, such as the rising number of cases that we see in our Latino communities, and the problems we have seen with reporting. Reporting is an issue that our health department has already worked to address, and we have been working alongside them and with a number of other partners that have reached out to us about specific strategies and ideas that we should be taking in order to better reach and serve our Latino communities. This is alongside of all of the amazing work that is happening every day with our Chicago Department of Public Health and every day along all of the services that our entire city government is enacting to support our communities through this crisis. We are fortunate to also have some amazing partnerships that have formed to take our work farther than the city could do alone. Specifically, we are working with AARP to launch a racial equity COVID-19 communication strategy targeting 50-plus year-old Black and Latino individuals and their families. This campaign leverages the broad reach and base of the AARP to deliver messages and information on key resources in modes that are easily accessible, bilingual, and contextually relevant to the communities of focus. We are also partnering with a group of Black-owned Chicago-based advertising and entertainment firms in a targeted outreach campaign. The social media campaign, conceived by Contender Labs in partnership with Spin Artist and Content Farm, leverages the #ButSeriously in an insightful and creative campaign that will be launched this week to provide critical information through the comedic genius of some of Chicago's funniest comedians. Additionally, we are collaborating with different organizations, hosting virtual town halls and discussions, including the 100 Black Men of Chicago and the Urban League, who are working to create forums, virtual forums, in which we can continue having conversations and gathering people together to talk more about what the needs are and what needs to be done. We continue to invite these kinds of critical partnerships to help us both identify needs and deliver targeted resources. I am now pleased to pass it on to one of our key partners in the Racial Equity Rapid Response Team, Ayesha Janko, Executive Director of Westside United.
Good afternoon.
Good afternoon.
Over the past 2 weeks, Westside United has worked with the City of Chicago to convene the Racial Equity Rapid Response Team. The work of the newly formed Racial Equity Rapid Response Team is central to Westside United's mission, which identifies structural racism and historical disinvestment in Black and Brown communities as pillars of disparity and inequities. The immediate investments needed to address the COVID mortality and infection rates in high-risk communities also warrants a long-term commitment that this initiative can deliver by building the capacity of communities and residents to arm themselves with the tools and resources to stay healthy and informed. Westside United is committed to working together to decrease the current COVID mortality and infection disparity gaps in Black and Brown communities by ensuring that targeted West and South Side communities have structures in place that allow them to sustain a long-term preparedness plan that provides screening, testing, education, and communications. Westside United is leveraging the work of our anchor institutions who are currently employing strategies like the Rush University Medical Center Command Center, which deploys information, volunteers, social isolation screenings, and other resources for housing insecure populations and high-risk senior communities. Lurie Children's Hospital has a COVID testing partnership with PCC Wellness in Austin and the Lawndale Christian Health Center in North Lawndale, and will be providing testing for communities soon. Amita Health has housing for COVID positive patients. Cook County Health is providing wellness checks and food insecurity screenings. The distribution of 1 million masks to safety net hospitals and Black and Brown communities distributed by Sinai Health in partnership with community leaders like Willie Wilson are all things that we are bringing from our network to enhance the capacity of our communities. We are working to continue to combine these capacities to customize a citywide community-based command center approach in each of our racial equity rapid response target communities to empower our community leaders to have the resources they need to act urgently to support Chicago's most resilient communities. We know that it takes a village to raise a child, and it takes a village to heal our city. And we cannot do this without the leadership of our mayor, without the leadership of our hospitals, but most importantly, without the leadership of our community leaders who are on the ground, fighting the battle, in the trenches, helping the people. At this time, I'd like to turn it over to one of our leaders, Darnell Shields, Executive Director of Austin Coming Together. Thank you.
Greetings. First and foremost, I'd like to thank Mayor Lightfoot and her administration for mobilizing this effort. At Austin Coming Together, our primary goal is to increase the collective impact of our members, community partners, improving the education and economic development outcomes in the Austin community. With the reports of how the COVID-19 has taken the greatest toll on the Black community, the importance of addressing the disparities that exist in Chicago is paramount to us. Austin and most of the West Side is highly populated by African Americans. And it is also a well-known fact that the social determinants of good health are not in our favor. The number of pre-existing health conditions that plague the Black community as a result of extreme poverty, systemic racism, make us more susceptible to the dangers of COVID-19. It is for this reason Austin Coming Together is proud to serve as a community lead in Austin for the newly formed Racial Equity Rapid Response Team, and I'm honored to serve as a steering committee member on this collective effort to address the racial disparities in COVID-19 mortality outcomes. Given our role as a community quarterback in Austin, I believe our direct involvement can help increase the rapid response team's ability to develop and implement strategies that specifically meet the needs of Austin residents. Having said that, one of our first orders of business is to work with the mayor's office to organize a virtual town hall this Saturday and other activities leading up to that to help inform our residents and further come alongside. To learn more about our organization and the information that we will be sharing, please visit our website at austincomingtogether.org or visit us on our social media platforms via Facebook and Twitter. And at this time, I'd like to call up the CEO of the Greater Auburn Gresham Development Corporation, Mr. Carlos Nelson.
Good afternoon, all.
Good afternoon.
My name is Carlos Nelson. I'm the CEO of the Greater Auburn Gresham Development Corporation and the lead agency for the Auburn Gresham Neighborhood Network. The Auburn Gresham Neighborhood Network is poised and organized to continue bringing racial equity, rapid response to the residents in our community. I want to thank the mayor and the city of Chicago for her steadfast focus on the disinvested communities on the south and west sides of Chicago. To date, in addition to ongoing wellness checks and door-to-door deliveries of food and essentials to seniors and other vulnerable populations, the Auburn Gresham Neighborhood Network has provided $75,000 in emergency rental and mortgage assistance to families and individuals suffering wage loss due to COVID-19. That is thanks to the city's Department of Housing. Our data shows, though, that there is a demand for nearly $300,000 more in financial assistance to our families. Additionally, we have launched the GAGDC Community Conference Line. It's a service called the Rapid Resource Information Line. It's a very low barrier way to stay connected to the residents, to the families, to the small business owners, to the students, to the other stakeholders in the greater Auburn Gresham community. All you have to do every day at 2 p.m. is call a number to get downloaded with information, 7 to 10 minutes of burst of information about ways to exist in today's difficult environment. We've shared information about managing stress in your lives, being counted since it's 2020, social emotional learning, and other virtual instructions. You can get more about the topics at 2 p.m. on the gagdc.org website. I am really excited to share the street activations that our Auburn Gresham partners implemented last week. Our partners have decided to descend upon hotspots in our communities, to pass out masks, brochures and information, words of encouragement, prayers, and the message of going home to residents in our community. You might have seen our kickoff last week. You may have seen Reverend Wayne Smith of New Pisgah Missionary Baptist Church or Father Michael Flager of St. Sabina, along with GAGDC's Social Enterprise, our Urban Green Team, and countless other volunteers passing out 5,000 masks in less than 28 minutes. Upcoming this week, Target Area Development will join, as well as Alderman Howard Brookins, whose ward makes up the largest percentage of the Auburn Gresham 60620 community. Also, Alderman David Moore, Alderman Derek Curtis, Alderman Rod Sawyer, Leo High School, and others will be mobilizing in separate locations to distribute masks, to distribute information to the Southside residents. This crisis has brought community leaders and partners together in a cohesive and unified voice. One message: to save and sustain lives in Auburn Gresham and our Southside community. Lastly, and I know I've run out of time here, lastly, I'd like to mention that for the last 3.5 years, the Auburn Gresham community has planned, has researched, has commissioned market analyses, has designed a regional health and wellness center anchored by a full-service health center. to be placed right at 79th and Halsted, a 60,000 square foot facility. We've purchased the building. We've had difficulty in finding the last of the funds to get this project done, but it's frustrating and it's sobering to think how many families would have been supported or possibly lives saved if we'd been able to stand up this Auburn Gresham Health and Wellness Center. When this pandemic is over, it is imperative that we as a greater community continue to fight continue to fight other long-standing epidemics like poverty, like food instability, like little access to health care, and other social determinants of health with the same vigor that we're fighting right now. And thanks to the leadership of Mayor Lightfoot, I know as a community we will continue to do so. Thank you. I'd like to now bring up another community development partner, lead steward, Anton Sills of South Shore Works.
The new normal, I gotta make sure I take everything off. Good afternoon. Good afternoon. Thank you, Mayor Lightfoot, for having us here today. My name is Anton Sills, Jr. Just want to kind of report a little bit about what we've been participating in the rapid response and the racial equity task force. And I'm gonna keep mine shorter because I got a minute left on my phone. But one is, of course, has been echoed here. We've been advocating that, of course, that the expansion of testing happens. We hear this all the time from our community residents across our community. They want to be able to know and have the right kind of information so that they can inform each other around what's happening with the virus. The second thing that we want to make sure that, in particular, PPE, so they talked about the mask and the gloves. We have been partnering. South Shore Works is a partner organization made up of several different organizations within South Shore. We have been able to distribute both PPE masks and gloves on 75th Street at the Quarry, courtesy of Real Men Charities, and notarized and increase the peace. Several micro local organizations that are doing work that is very important. So increasing the amount of PPE, making sure that people understand how to use them, how to clean them, definitely the instructions on how that happens. So that's so important. The third thing that we are at this table advocating is the expansion of this racial equity team, because Chicago is made up of 77 communities, but oftentimes it is not just across the street. You can live in a different neighborhood. So the opportunity for us to further dive into what has been a long-standing, the huge racial and social disconnection, and you talked a little bit about it earlier around the systematic kind of approaches. So what we are thinking is that there needs to be an expansion there of other community members, and we are sure that that will come. And so this will be able to tap into the assets that are currently in our community, the black psychologists, the black sociologists that exist in our community that have years of resources and access. And critically to this, in terms of the work that we've been doing, not only in South Shore, but the work I do in Inglewood, is around making sure that we have access to super nutritious foods in our community as one of the combative things that we can do to make sure, regardless of the virus or not, that we are protected and then our immunities are high, that we have access to more places for green space so that we can have more physical activity in our community. These are all pieces of combating chronic health diseases that are making this feasting of this virus on diabetes and hypertension so much more critical in our communities. We also want to bring and raise awareness to those who are returning citizens. South Shore has one of the highest numbers of people who are living with government subsidy in terms of housing. So housing is a critical issue that we need to make sure that we're taking a look at. And as people are coming, returning citizens are coming out of the system, we want to make sure that this body is also working with the county in order to deploy ways that we could be working together, make sure that they're tested, they're often coming back and not having a space to live, so their homelessness, so that cycle. And then I think ultimately we want to also uplift and talk about the youth homelessness issue. That's a big issue. They are the ones who are usually not participating in wearing PPEs and masks. It's also because they're not also stabilized in that way. So we have to be really inventive, not necessarily browbeating them, them, but also, having both ends so that we can make sure that we're supporting everyone in our community so that we can remain healthy. Lastly, I'll just end in saying, but at South Shore Works, we say working together for a change. This provides our city an opportunity to really dig into decades long, if not generational long. I was watching The Last Dance last night. Like the things that we're dealing with in our particular communities have been going on for so long. And the death that we're experiencing in our communities needs to make sure that we are able to address them long term. So we think this is another opportunity to make sure that we're marshaling all those resources in our community. And again, thank you, Mayor Lightfoot, Candace, and your team for making sure that we came out together. Thank you, Mayor Lightfoot.
So before we open it up for questions, I just want to kind of emphasize and summarize what we just heard. We stand here with a real opportunity, an opportunity to really move our city in a fundamentally different direction. And I meant what I said before, we have to be intentional about all the work that we're doing in response to this virus to make sure that we are building the foundation that it will last and endure so that this work continues after we're on the other side of the pandemic. And I also have to say that in this otherwise often dark cloud, I see these community leaders, I hear their voices, and I'm proud. I'm proud and I'm hopeful because I know that we have the tools and the talent at our disposal to really address and solve some very, very tough problems. So I just want to say to all of you, thank you again so much for your partnership, for your hard work, and we are in this with you together, shoulder to shoulder. So with that, I'm happy to entertain your questions. Go ahead.
Mayor, thanks very much. Some incredibly important things that you're talking about here. Broadly speaking, you said that this COVID-19 emergency really illuminates the broken and racist system that we are in. However, we've known about that broken and racist system for generations. Dr. King talked about it in 1966. We have blacks dying at nearly 4 times the rate of whites here. We knew about this in January. What more could have been done to stanch the flow of this development?
Well, look, I think a lot has been done for years. I mean, all these community leaders, our Department of Public Health, a lot of city departments have been working in neighborhoods to try to address some of these big issues. There's a reason why we had a poverty summit in late February, to really shine a spotlight on the generations of disinvestment and inequity that has led to the disparities that we're talking about now. So I can't account for what happened before, but what I know is that in this moment, we are going to do everything we can to right the wrongs of the past. And it's not going to happen overnight, but as I said right before we started taking questions, I feel a power in all of our hands because of this concentrated focus that this moment has given us. So we're building connections across the city in neighborhoods. We're breaking down silos, and we're starting to see the results of that work in real, tangible efforts to solve problems. So I feel very hopeful and optimistic in this moment, and we are looking forward, not in the rearview mirror. We're not ignoring the past because we can't. It is our present. But I feel very optimistic about the possibilities for us as a result of the work that has really been accelerated as a result of this virus.
So going forward then, the areas that you can control, you're laying this foundation. Let's say something like this happens, say 5-7 years from now. What would you like the community response to be? What are some of the silos that would be far more robust, that would help you to take a much more aggressive and more effective approach at the beginning of something like this in the future? Well,
what I hope between now and, God forbid, another crisis like this, we do a number of different things. Number one, we've known for a long time that there are significant life expectancy gaps all across our city, and particularly in Black and brown neighborhoods. This work is about getting at that problem. So that's number one. I'd like to see a shrinking of those life expectancy gaps. We've known for a long time that there are issues around food insecurity. I want us to use the work that we've been doing from day one of this pandemic, building systems around food delivery. I want that work to transform itself post-COVID into a lasting infrastructure to address that kind of insecurity. Housing insecurity, that you heard that from a number of different speakers. This is a huge problem. I've been talking about this going back to the campaign days. I think that we have to now use this as an opportunity to really move forward in a much more aggressive and rapid way to address housing insecurity. My friend here brought up the fact that we have so many returning citizens coming back into Chicago literally every month. We have to work with our state partners and make sure, for example, that no one comes out of IDOC unless they're set up for success, meaning they got to have an ID, number one. They should be connected up with a range of different resources. Just for starters, Medicaid. So there's a lot of things that we are seeing as a result of our focus on this virus that weren't in the dark before, but now we know with a true sense of urgency that we've got to address a lot of different things, stitch together the safety net that frankly was shredded, particularly during the years of the budget impasse, and move forward much more quickly to really solve problems in a hyper-local, but also at a macro level, because that is really what racial equity and inclusion has to look like now and in the future.
Mayor, let's talk about testing. Everyone is saying, a lot of people are saying, you're saying that we're really never going to get out of this until we get a really strong testing regime. And we're seeing elements of that all around the city and around the region. Mm-hmm. We heard a number of things at the state and the federal level over the weekend, specifically at the federal level, that the movement is going to be moving towards testing, tracking, and supported isolation, this new acronym TTSI. How do you feel testing is going in Chicago right now? And how much better does it have to be so that we can start to move towards semi-normalcy?
Well, I'll start and then I'll invite Dr. Arwady. We are definitely better than we were before, but we're nowhere near where we need to be. I mean, again, you've heard from all of these leaders and others would tell you, we really need to have widespread testing in every neighborhood. We're going to need a significant increase in our testing capacity before we can even think about reopening up our city, not just our economy, but our city. So imagine going into one of these office towers down here in Chicago. Without widespread testing, are people going to feel comfortable getting on public transportation, coming downtown, being in congregate work settings? What about going to houses of worship? Are people really going to feel comfortable without widespread testing, going back into churches and mosques and synagogues without widespread testing? You get the point. We could go on, but we have to have a much deeper testing capacity linked up to the public health system, and I emphasize that. We've seen some testing go up around the city, and they're doing these drive-bys, but they're not keeping great records, and that information's not being fed up into the public health system so that we know real time what the impact is. That's absolutely critical, and we're going to put some controls around that. But the testing is the future. It has to be part of our present until there is a vaccine, which we have no idea what the timeline on that is, or if we'll get to a vaccine. I shudder to think about that possibility, but we know it's not until deep 2021. Dr. Arwady?
Yeah, I would add that obviously testing is a huge priority for us, and we use this same data that you see on our website to really prioritize where we need to get testing. So I've got a whole team of folks at the Chicago Department of Public Health who are looking at this data and then matching it up against where our outpatient settings, where our inpatient settings, where can we help encourage partnerships between some of our, for example, larger hospital labs and some of our smaller outpatient facilities facilities? How can we think beyond health facilities to other settings where people may need testing? We're at a point now where we're doing about 1,600 tests a day here across Chicago. And if you look back just a week or two ago, that's what we were doing over a week. So we really are every day seeing significant improvement. And what's good is that we're seeing that improvement in particular both in our clinical setting, meaning when you go to see a doctor, when you go to the hospital, but also in our commercial setting. And in the commercial setting is where you think about the traditional way that you go to the doctor and you have to get some blood work or you have to get a test and your doctor is able to order that. We're starting to see that capability really grow. And that's where we'd love to see that very robustly, because then you have quicker turnaround times, then you have all of the data being appropriately reported to public health, like the mayor was referencing. And so we have some pretty good plans. I think the other thing, though, is that the testing at this point that we're seeing is the part that's been fully FDA approved is all diagnostic testing. It's the testing that looks for the presence of virus right now. Is somebody sick right now? And what's coming is the serology testing, the antibody testing, and that's the blood test, the blood finger prick that lets you know whether somebody has been exposed to and their immune system has fought off the virus. So where we think, really in a few weeks, the first few have just gotten the emergency use authorization from the FDA. They're on the path to being more widespread and available. And it's that kind of testing, I think, that we'll really be able to use to have some understanding kind of across populations. And we think about bringing tests to people, not waiting for them to be sick to come in. So we're sort of at a moment of transition where testing is absolutely on the top of our list, and we've got people pushing for it every day in all kinds of ways. But we're also looking ahead to probably just a few weeks from now where we'll start to have more of that validated testing available to really understand what we've seen. Even in our homeless shelters, for example, we're now doing hundreds and hundreds of tests a week. We're identifying people who are asymptomatic, who don't have symptoms or have been very mildly ill, helping to have the testing available to see what that looks like across the whole population will be really important, not just for people now, but as we look ahead. About how big which number is?
That number of people around who are totally asymptomatic may have already.
Yeah, so that is one of the biggest questions. You talk to different epidemiologists, some will say 20%, some will say 5%, some will say 1%, some will say 30%. If I had to take a guess, it's probably less than 10% here in Chicago, but I don't know that for sure. We'll only know that once we start to actually have some of this testing done.
Sorry to jump in, Dr. Arwady. There is a follow-up question for you on testing from Mark Conkle. Can you please share any data on how much testing is being done in African American neighborhoods hit hardest by coronavirus? And if that data isn't available, when will it be available?
Yeah, that data is available. So we continue to see the majority of our testing in African Americans. 44% of it, of the testing that is done broadly, is done in African Americans, again, in comparison to 30% of the population. So we are pushing testing where it is most needed. We track that very closely, of course, as we think about increasing access even further.
And where is it available?
The data is available on the website, chicago.gov/coronavirus, right up at the top of latest data. And we are actually, I failed to mention this earlier, but as of today, we are also posting more detailed geographic data related to deaths, including deaths by race, ethnicity online as well.
Thanks very much. Mayor, the protests that are happening in various places around these stay-at-home orders, we're seeing them pop up here, there, and everywhere. It may be political, it may be not. What is your take on those protests? What kind of patience do people have to have when they start to see those things?
Well, I guess the question that you have to ask yourself is what kind of patience do you have to save your own life, save a life of somebody in your family, save the life of someone in your network that you know? That's really what this is about. It is a very stark choice. I recognize that it's difficult for people. It's difficult for everyone. But the data's really clear. We are making progress in the city of Chicago because we're seeing greater compliance with the stay-at-home order, pure and simple. So the question is, Do you want to be temporarily inconvenienced, or do you want to lose your life, or have somebody that you love or care about lose their lives? I've said this many, many times from the very beginning of this pandemic. This virus is the kind of thing where the actions of one have consequences on the actions and the life of many. So we have to all be in this together. We can't have a patchwork of different standards in the same region, let alone in the same state. It's bad enough that we have a patchwork across the country. You know, I watched the governor of Florida, I think, fumble once again. His leadership has been wholly lacking in this pandemic, and then he reopened the beaches. God help us all.
Keeping with that idea, you've got just a gorgeous day outside, and we've got a weekend coming, and people are in their gardens, they're planting. Again, just a quick little opportunity to talk about how important it is to follow these guidelines, and what are the police going to be doing about that in terms of enforcing them?
Well, the police department's been very rock solid on this. We're trying to educate people into compliance. The last thing that we want to do is go to the extreme measure of having to arrest everyone, and luckily that's been very, very infrequent. But yes, it is nice. I absolutely understand that people want to get out. There's nothing that precludes you from going outside, getting some fresh air, walking the dog, going for a walk. The point of this from the very beginning, and remains the same, is you must avoid congregate settings. You must avoid circumstances where you are congregating in a park or any other place, a grocery store. You've got to spread out. You've got to give yourself social distancing and really take that seriously. And if we do that, of course people can go outside, but you got to be smart about it.
Would you have any comments on the situation with United Airlines? They announced a $2.1 billion loss in their first quarter. Huge Chicago company, national, international. What's your take on that?
Well, unfortunately, the circumstances of United, I think we're going to see play out across the airlines. We've been in conversation with them from the very beginning of this pandemic when people stopped taking airline flights, really following the guidance that was given at various levels of the public health departments, city, county, state, and nationally. Airline traffic plummeted. That's why we were supporters of the $60 billion ask from the airlines to the federal government. But I think more is going to need to be done. Air travel obviously is critically important, not just for passengers in business and leisure, but also freight. So making sure that we've got an airline industry that is vibrant and strong, I think is critically important across the country, but is vitally important to the city of Chicago. So we continue to work with and support our airline partners, as well as the airports and the various businesses inside and outside of the airport that rely upon air transportation for their livelihoods.
Were you surprised, though, by that number?
I hadn't focused on the number. It's a big number. There's no question about it. But I'll be interested to see what we hear from some of the other major carriers, because they're having the same kind of B-type problems.
So it's Monday morning, and I had to wrestle my kids out of bed, and the sunshine wasn't helping them to get up, but they had e-learning waiting for them.
Yes.
As the children across Chicago and the region are. How satisfied are you with CPS e-learning as we approach a new week here?
Well, I think under the circumstances, and given that CPS wasn't set up for an e-learning platform, the remote learning that they're doing, I think has been solid. The plans are solid. I think it's a little too soon, since it really began in earnest last week, for us to be able to assess it. But I know that Dr. Jackson and Dr. McDade and their teams are working really hard to make sure that our CPS students get a real education from now through June 18th, which is the end of our school year. We can't afford to mail it in. We can't afford not to have accountability. And so we're going to continue to push creative opportunities for our students to continue to learn. I worry a lot about the summer slump, which is a phenomenon, but particularly this year, given the year that we've had, where they missed 2 weeks of school in the fall because of the teacher strike. And now in this adapting to this new reality and given the challenges that some of our families face in terms of being connected up to digital opportunities for the kids to learn, I think we're learning a lot through this. But I know that it's not the same as being in your classroom, being with your teacher. I mean, I think about the elementary school children in particular. You know, I have very fond memories of my elementary school years. It wasn't a fantastic school, but, you know, we had a class size of 30-ish with one teacher, and those teachers meant the world to us. We looked up to them. We spent as much time with them as we did in many instances with our parents. So not having that physical connection, I think, is a hardship, particularly on our younger children. I've seen some very interesting and creative things that teachers all across the country are doing. I saw one that really stuck in my mind, and I talked to Dr. Jackson about it over the weekend, where an elementary school teacher literally went to the driveway of one of her students and, with appropriate social distancing, was reading a story. Now, I mean, that's unbelievable dedication. And we've got teachers here in our system that every bit is dedicated, and they really need to be now, because we got to think about creative ways so that we still remain connected up with our teachers. My daughter virtually every morning wakes up in similar circumstances as yours, wakes up to a video email from her teacher, and they're having classes on Zoom. Those kind of creative ways to stay connected are really important.
I was going to ask you about your daughter, but that's fine. One last one for me, then I have a couple of others from other colleagues.
Sure.
The smokestack situation. What about it? Do you allow them to finish this demo? What's the latest on that? And how upset are you over this as we continue to see we see what kind of destruction this caused?
Look, I said this before, I wouldn't tolerate this in my neighborhood, and neither should the people of Little Village tolerate it in theirs. I think the developer has taken responsibility, and rightfully so. It was an utter fail. We were out there more recently this weekend, and had they taken the steps that they took that I saw, which is literally wet down the entire property and the footprint and beyond of where the smoke stack was going to fall, we wouldn't have seen that. Now, I can't erase the past, but I want to make sure that we are moving forward in a way that honors and protects the Little Village community. What I know is that the building in its current state is dangerous. It's not structurally sound. And there's a lot of debris that was left from the other parts of the demolition that's dangerous. And it's literally a magnet for scavengers. Despite the fact that they've got a high fence around the entire property, I learned over the arc of this, of that work, they've had 150 break-ins, even though they've got 24-hour security. So we're working with them to figure out how we can mitigate, I think, a very dangerous circumstance with the building and the debris. You can take your time. So we're working on that.
All right, thank you. This is those, I guess, are my questions. This is a question from Tamon Bradley from WGN. Alderman Martin wants people struggling to pay rent who are struggling due to the COVID-19 fallout a year to pay back rent. Will you put your weight behind this proposal and encourage other aldermen to go along with it?
Well, here's what I know. This is a challenge. Meeting your bills is a challenge for a lot of folks. There's no question about it. That's why one of the first things that we did was to stand up a $2 million fund to help people who were struggling with rent and struggling with their mortgage. But this is a complicated problem because the renters, to be sure, are hit, but so are the landlords. The landlords are struggling to meet their mortgages. Ultimately, where we need to be is to have the banks that hold these mortgages provide some kind of relief all the way down the line. So you can't just solve one part of the problem and ignore the other pieces of it, because I know a lot of landlords that maybe have one or two buildings. If a renter doesn't pay rent for a year, what happens to those people who have to pay their mortgage? They rely upon those rents as part of the revenue stream that they need to pay their mortgages. So we are working on how we solve the entirety of this problem. But I will also just say this. I learned a lot about people through this crisis. And my view is, if you really want to solve problems, you work collaboratively. You work constructively with your colleagues. But when I learn about somebody wants to do something because now there's a press release, or because I read about it in Crain's or Trib or Sun-Times, that really tells me a lot about the seriousness of purpose. These are serious issues. We are working as a city, and we have been from day one, to address them, because people are really feeling the weight and the burden of this. But the way to do that is to make sure you understand all the people affected, all the stakeholders, and then you work collaboratively to come up with a solution that solves the entirety of the problem, not a piece of it that then has catastrophic consequences for other stakeholders.
All right. And last question here from another reporter. This is from Charlie Meyerson. Madam Mayor, what can you tell us, what do you know so far about the murders in Oak Park of Leslie Ann Jones and Thomas Johnson, who, as a hearing officer for the Chicago Police Board, presided over so many high-profile Chicago police misconduct cases?
Well, let me just say, when I learned of their deaths, I was deeply shaken. Tom Johnson was a really good man. He's a very smart lawyer, very able, took on a lot of, I think, important work over the arc of his career. I didn't know his wife as well, but everything I've heard about her says that she was the same kind of incredible, dynamic, giving, and gifted lawyer. I don't know much yet. I think the investigation is still very much ongoing, and I don't want to get ahead of the Oak Park Police or the mayor in Oak Park, who I've been in contact with. But it was a horrific thing. No one deserves to die in the way that they died, and I am hopeful that those individual or individuals, plural, who are responsible for taking the lives of these two people in such a violent way are brought to justice as soon as possible.
Last question for me. The President's going to be talking again about 4 o'clock today. What do you want to hear from the White House?
Well, that's an interesting question. Let me choose my words carefully. Look, I want to hear the things that we haven't heard yet. I want to hear a message of unity. I want to hear a message of help. The President has the largest megaphone in the world. And I want to know that he is listening to the data, listening to the scientists, and coming up with a plan that is going to move the country forward in a united way. Every press conference, there's bits and pieces of this or that, making declarations, taking it back the next day. I want a coherent message that shows real leadership, and leadership that is informed by the science and the data, and respectful of the reality that mayors and village presidents and governors are really on the front lines of this, and that our voices need to be included in the discussion, because whatever happens in Washington, D.C., we bear the burden of it here at the local level, and we are the ones that have to implement and execute and be responsive to our residents.
Mayor, from Fran Spielman. Can you please tell us about the offer made by Dr. Willie Wilson to sell masks at costs to the city, and why the city hasn't taken him up on it?
Well, I'm not sure that it was at cost, but what I can tell you is this. Some weeks ago, Dr. Wilson reached out to me about the opportunity to purchase various masks. I immediately sent that to the person who was then kind of running point on procurement issues for those kinds of products. The feedback that I got was a couple of things. Number one, that given the great work that CDPH does all year round, that many of the products that the doctor was offering, we actually had a very solid stockpile in place. So that's issue one. Number two is the lead time for when he could get us the products was weeks longer than what we were seeing from other folks. But the thing that really gave me personal pause was, as I understood it, Dr. Wilson's requirement that we pay him all the money up front and in cash. Millions of dollars in cash is not something I'm ever going to do with taxpayer dollars.
Mayor, a question from Dorothy Tucker. We know there is an issue with access to healthy food choices in some Black neighborhoods. What do you do to stop those retailers who seem to push junk food instead of healthy food?
Well, I think I believe in the market forces in this. I think we have to give people alternatives. The reason why people are going to the little corner market that doesn't have a full array of healthy food choices is because they don't have other options in their community. The reason why, we talked briefly about this, the number one issue that keeps coming up over and over again in Auburn Gresham, and there are many other communities where this is an issue to be sure, around food instability, is because there's not enough healthy options. So we know that this is a problem. We've been working to address it. But as I said earlier, the realities of this pandemic is that we have to speed up in a significant way a lot of the other work that we were doing to build healthy and strong communities, and food is at the top of the list. It's one of the first working groups that we stood up as part of our emergency operations response, and it continues to be an issue that we work in partnership with a lot of different stakeholders around, because we know that this is an issue of concern. And one of the things that I have been pushing in particular is to make sure that SNAP recipients in Chicago can order groceries online and have them delivered to their house. There's some hoops that need to be jumped through at the state level, but it's an issue of great concern to me. I've raised it a number of times, not only with our federal delegation, but other members of the House of Representatives and the Senate. We've got to get this problem solved.
From Kelly Bauer at Block Club. Will the city provide any additional assistance to small businesses besides the Resiliency Fund, since the federal Paycheck Protection Program ran out of money?
Well, we're doing two things. We're continuing to raise money for that fund. And so we hope to push even more loans out the door as quickly as we can. We're obviously all painfully aware that the federal effort has now run out of money, and hopefully this week they'll get that solved and have another infusion of cash. But one of the things that we have said to our federal partners is they need to expand the accessibility of the small business loans. It can't just be filtered from the big banks to their clients. We know that small businesses, particularly here in Chicago, but I think this is really true across the country, many of them don't have a long-standing relationship with a big bank. Maybe they go to a neighborhood bank. Maybe they don't really have a relationship beyond a checking account. Many small businesses are unbanked. They don't have a relationship. And in Chicago, as is true across the country, we have business owners who are not citizens. They are undocumented, but their pain is no less real than anyone else. So we are working on continuing to push more money out, continuing to raise money to do whatever we can to help our small businesses stay in business and then come out on the other side of it.
Last question from A.D. Quigg at Cranes. Some aldermen criticized the budget ordinance codifying your executive order, suggesting you were bypassing council oversight. What kinds of decisions at this point do you need to make on a dime without an aldermanic sign-off?
Well, if we were bypassing aldermanic oversight, we wouldn't have presented an ordinance, so that's just not true. We are working with Alderman Pat Dow, the chair of the Budget Committee, and a range of other aldermen to codify the executive order. The draft that I saw over the weekend initially had a lot of other things in it that weren't necessary or relevant at this time. So we have presented a slimmed down version that allows us the flexibility, for example, to take in federal dollars that are now coming and make sure that we are responding quickly to this pandemic. And we'll continue to be transparent. We've had, 15, 20 different substantive automatic briefings since March. We are trying to engage with them as productively as we possibly can.
Thank you, everyone.